Hello, my name is Sam Stewart. I am an emergency and critical care specialist at the London Vet Specialists in Belsize Park. In this presentation, we're going to be talking about navigating veterinary care in the setting of COVID-19. First, we'll go over a quick overview of what this presentation will cover. First, we will start with some terminology of some of the words that we are going to use throughout this presentation. Second, we will review some of the effects that COVID is having on normal routine hospital function and the challenges that this can present to our ability to see and manage our patients. Next, we will then differentiate between the different types of emergent and non-emergent cases that we can see and how to classify them. And then finally, we will talk about how to manage these emergent and non-emergent cases once we've been able to appropriately categorize them into which type they are. As far as terminology goes, we'll first start with the term emergent, which are essentially conditions that can result in an immediate or a significant threat to life. And so these are going to be your more severe emergency cases, such as dogs that have been hit by a car, unstable diabetics that could potentially be in ketoacidosis, or anything that just generally looks unstable or shocky. And so really the big key to this is that there's not only this immediate and significant threat to life, but there's also a high potential that it will continue to deteriorate if left unmanaged. After emergent conditions, there are then urgent conditions, which are ones that still have the potential for a significant impact on the health of the patient. However, that patient is currently stable. The key, though, to urgent conditions is that they still have that risk for deterioration. So unlike emergent cases where it's a little bit more obvious that it's significantly serious enough for that patient to present to the hospital, the urgent cases can be a little bit in either direction and require a little bit more interrogation to figure out, does this patient truly need to be presenting to the hospital, or is this something that we can maybe manage remotely, which is stuff that we're going to talk about throughout this presentation. Thirdly, there are the non-urgent or routine cases, and so these are conditions that are not disease-related or have a pretty minor impact to the health of the patient, like a torn toenail. And so if left unseen or unmanaged, there's little potential that these cases are going to deteriorate. So it definitely falls into a category of cases that might not need to present to the hospital right now. Continuing with our terminology, we'll now talk about remote consultation. And this is essentially where you meet with the client either over the phone or over a video conferencing room in order to conduct what we would call like a digital physical exam. And so this is a good way to take history. You can do a more visual exam of the patient, obviously, because you can't touch them or sculpt them or do a full exam, but you can still do the visual things. You can look at, is there any signs of weakness? How does their breathing look? And what is the quality of that breathing? Does the patient seem alert, or does it seem like there's any sort of mental, obtundation or lethargy that you can tell? And then from those sort of more digital or remote examinations and history taking, you might be able to make some recommendations with that client, or if you feel like a simple recommendation of something to do isn't enough, then you know from that point that it is appropriate for you to recommend for that patient to come into the hospital so you can do a more thorough evaluation inclusive of diagnostics. And so that kind of leads us into our next term here, which is physical examination. And this is where you are actually physically meeting with the client and the patient in person at the hospital, where you can perform a full examination, a full assessment of that patient. And you also have the ability to perform diagnostics because the patient is physically there in the hospital. And if you need to administer any treatments, that's not something simple and over the counter or a simple prescription that the owner might be able to go just pick up themselves from the pharmacy. This patient is now in the hospital where you could administer those treatments. The last term that we will go over is remote triage. And so this is very similar to remote consultation. However, it is not a full assessment of the pet. It is merely just meeting with the client, usually just over the phone. This one isn't as important to be a video, but the goal is to take a short history, and try to get a sense of, is this an emergent, an urgent, or a non-urgent / routine case. And so from that remote triage, you can get an idea of which of those categories that patient falls into, and then decide, does this patient need to physically come into the hospital for a physical examination, or does this sound like a non-urgent or a low-grade urgent case that might benefit from just simply a remote consultation and not presentation to the hospital? So as most of us already know, COVID has had quite a number of challenges that have really affected the way that we can manage our routine, kind of normal hospital function. And a big factor that plays into this is that it has caused us to really have to evaluate new ways that we protect both our clients and our patients, but also ourselves and our staff. And so some of these big changes are, things that we hear about quite frequently in the news right now, which is our social distancing, which can make it very hard for us to actually interact in a sort of more normal way with our clients. Quarantining, where both clients and staff might not be able to come into the hospital because they could have COVID and then have that potential to be spreading it. But then also the government ordered lockdown, where we're all expected to be staying home as much as possible. And we really have to decide, is it necessary for, say a client to be leaving their house with their pet to come in? Is that really needed? And so, this has not only difficulty for us as the veterinarians, but for the clients, because some of them might not be able to physically come to the hospital, say they themselves are in quarantine and they need to either find someone else or find an ambulance service to bring their dogs in. But it also causes a lot of confusion because, like I said, there's the lockdown that's currently in place, and it's not always obvious to either the pet owner or the veterinary staff whether it's appropriate for that patient to be coming in and for that client to be unlocking down and coming into the hospital. Not only that, but decreased ability for the veterinarians to actually physically meet with the clients. And this is a extension of the social distancing, where many hospitals aren't having clients physically enter the buildings anymore and are just having them drop their patients off at the door, and then their pets are then taken in by a staff member. And the veterinarian tends to have to do most of the communications either over the phone or through some other modality. And it's still able to be done that way, but it does present challenges because it's not a kind of routine, familiar workflow that we normally do. So it is a pretty big change for what we're used to. And then lastly, a big effect is just the reduction of physical veterinary staff that we have available. And this can be from people being, putting themselves on quarantine, but also all hospitals across the board are choosing to reduce their staff because in a way to protect ourselves, the less staff we have in the building, the more protected we are. However, it does raise that challenge that we might not have the full staff that we're used to and will make case management a little bit more challenging. First, we will talk about emergent cases and how we categorize patients into this group. Now, these are going to be patients that require some form of immediate intervention. And so these are patients that have, say, severe injury, they're unstable, or they're really shocky. I give some more examples on the next slide. So these are just some big, kind of more broad categories for now. But ultimately, these are patients that are pretty ill and are likely to deteriorate or even die if we are not going to give them some form of intervention in the immediate period of time. And so many of these owners will know right off the bat without having to consult with you if their patient is truly that sick that they need to come into the hospital. And so in those situations, there is no need to categorize these patients because they're just going to show up at the hospital. However, because of COVID and that confusion that many clients are going to experience about whether or not they should be coming in, a lot of them will call the hospital beforehand. And so this is the exact definition of what a remote triage is. It's when these clients call in, you can do a short phone consultation just to get a better idea and determine, does this sound like an emergent case and I should just recommend that they come in to get a physical exam? Or does this sound questionably like an urgent case, and before I recommend them to come in, we should first start with a remote consultation? And so if it's a remote consultation, you can then transition that remote triage directly into the consultation, determine if this pet needs to come in. If it doesn't, make some recommendations, maybe give them a prescription to their local pharmacy, or if it's still questionable or it definitely sounds like it's emergent, then recommend that they come in for the physical exam, where you're then able to do a more thorough assessment, diagnostics if you need them, and the pet is then there to actually receive treatments if they're indicated. Now, this here is a list of some of the types of emergent cases that we could see. Some of these are going to be pretty obvious, severe trauma, seizures. A good qualifier for the seizures are going to be the ones that are, starting to approach the classification of cluster seizures or status epilepticus, single one-time simple seizure, especially if it's a known history of seizures. I wouldn't say classifies as an immediate emergent case, but does kind of hit that urgent kind of case category. Definitely significant weakness or collapse, that's for sure for them to come in, prolonged coughing, especially if there's difficulty breathing. Here at the top right, I have a little video of a dyspneic cat where you can see that increased effort. So this video here is even a good example of how you can do a remote consultation with a client, essentially a telemedicine approach, where they might be able to show you a video of their pet, and just from this simple video here alone, this 10-second clip, I can tell this cat is bad enough that they should be bringing this cat into the hospital. So some just other quick examples that I have on here, dystocia is, again, obvious one. Abdominal swelling, could that be a septic abdomen? Could there be a GDV there? Top of the second list here, retching, especially if it's non-productive retching, again, like you might see with a GDV. Toxin ingestions, again, this one will have some wiggle room because you will have to judge, does this sound like a significant enough of a toxin ingestion where this patient needs to present to the hospital for decontamination or any other sort of treatments like activated charcoal. Struggling to urinate, defecate, I think the big one that we think of there is blocked cats, clearly an emergency case that needs to come in. Excessive urination and thirst, again, you have to give it some wiggle room and decide if it's truly something that is emergent and not just urgent. GI signs of significant lethargy, kind of cluing you in on some pretty significant, say, like maybe dehydration or something more serious underlying that those GI symptoms. Treatment and monitoring of Addison's disease, again, we don't want these patients to have any Addisonian crises. Unstable diabetics, especially if we think there's a concern for ketoacidosis. Ileus, these are sort of the more known ileus cases, maybe dogs with inflammatory bowel disease, or we know they have a problem with ileus and say that ileus is now causing them to have lots of regurgitation and we're worried about them getting an aspiration pneumonia. Those would be a case where they should probably come in and be seen. And then lastly, euthanasia. Unfortunately, there's going to still be pets that hit that kind of period in time where euthanasia is the best option. Those clients, unfortunately, kind of have to come in for that unless you know of a traveling service that is able to do those at home. However, obviously, if a client needs to come in for euthanasia, we should still allow them to do so. All right, so next we are going to talk about our urgent cases. And so these are patients that are ill or have some underlying condition, but overall are considered stable. Their vital parameters are pretty normal. There's no severe lethargy. They're eating, maybe but just a slightly decreased appetite. So, again, you have to use some level of subjective assessment, but if this patient sounds like stable and therefore doesn't require an immediate intervention, that would be classified as an urgent case, keeping in mind the caveat that these patients could require more immediate interventions, which is why you need to still do some sort of an assessment with these pets to make sure that you're appropriately classifying them into what group and those recommendations that you then pass on to the client. And so typically these patients will be identified as urgent following a remote triage where you can tell based on the history that the client is telling you that this is not an emergent case, but is an urgent case. So therefore, you're going to recommend for them to not come in. Now, simply from that remote triage, you've not really made any recommendations for the client. We haven't answered the problem that the client is bringing to us based off of what they are observing with their pet. We've just told them that it's not emergent enough to need to come into the hospital. And so this is where we are going to transition into the remote consultation, where you're going to actually do now that remote exam. We're going to talk to the client more thoroughly, get a visual inspection of the pet, and then from that be able to make some treatment recommendations or give the owner some guidelines in terms of what to do. There might also be those occasional cases where we go through that remote consultation and realize that this patient has been improperly classified as urgent and is actually emergent. And so we are now going to have to go from a point where we're doing a remote consultation where we can't do a full physical exam, diagnostics, or treatments to recommending that this patient actually does come in following that remote consultation to have a full physical examination and diagnostics and treatments if indicated. So here are a few types of urgent cases. So these are going to be like mild trauma, like a nail pull or a split nail, something pretty minor. Some simple skin issues, anal gland scooting, probably a dog that just maybe needs an anal gland expression. Post-op checks, again, make sure you discuss with the client and really make sure that pet sounds like they are doing well at home to not warrant coming in immediately for that post-operative check. Medication rechecks, especially if these are for chronic medications that these pets have been on for a while. A simple remote consultation with that client to check in should be enough to suffice you being able to refill those medications. GI signs without significant lethargy. So if you remember, GI signs with significant lethargy were a reason for emergent cases. And so if these pets have GI signs like some simple vomiting and diarrhea of only a couple episodes, they're not very lethargic, they're still drinking, they still have fairly good energy, that would be classified as an urgent case where we would give those owners some recommendations over the phone and have them come to the hospital if it progresses to more significant lethargy. Jaundice, again, this should be used with caution depending on what other symptoms are coming with it. If these patients are also lethargic, not eating, they seem weak, that would move this into the emergent category and not the urgent category. Same with pallor, or if they're looking a little bit pale, we need to decide, is this a long chronic known thing that's been in sort of long-term management, or could this be more acute, in which case that patient should come in. Dental complaints, majority of these are able to wait unless there's a significant infection causing, say, like facial swelling because of an abscess or something more significant like that. Certainly lumps, especially if they are not becoming ulcerative or hemorrhagic or, an issue like that. Wounds, again, some subjectivity. I put a picture here on the right of some simple kind of puncture, maybe not even full thickness lacerations where, this pet doesn't necessarily need any sort of primary debridement or closure of these wounds. So therefore, this patient wouldn't need to come in. And so it just gives you another example of how remote consultations can be beneficial for a case like this, where you can actually see those wounds and say, no, I can tell these look simple and don't necessarily need suturing or a drain placement. So I'm going to have you monitor for X, Y, Z symptoms at home. And if you see them, then that will classify as an emergent case and you should come in. And then just lastly, finishing off this list, some simple lamenesses, eye complaints that are hopefully not painful. I think if they're painful, that would qualify as an emergent case. Anorexia, depending on the duration, I would say more than 2 to 3 days would push you into the emergent cases. Vaginal discharge, if it's simple, again, if it's accompanied by significant lethargy or something else that might clue you into it being a pyometra, that gets shunted over to emergent cases. And then non-specific lethargy, this is a big one for cats that maybe have a simple viral flare-up, which is why you want to see the chronic side of those symptoms going on for a number of days. That tells you that maybe it's not something like a simple viral infection, there might be something more significant underlying. Lastly, we will be talking about our non-urgent and routine cases. So the greater majorities will be our wellness appointment patients or patients that have either no underlying disease processes, or if they do, they're considered pretty stable and require minimal management. So kind of across the board, if these patients don't require some form of immediate intervention and don't have an underlying condition that you are concerned has that potential to progress in the near future, then that patient would be qualified as non-urgent. And so you would determine this, again, following that remote triage process. It's unlikely that many of these clients will present to the hospital primarily, and it's more likely that they're going to call first. And so through that remote triage process, you can then decide, is this truly a straightforward, non-urgent or routine case, in which case you will then recommend to that client to kind of touch base or look at scheduling an appointment until after the COVID kind of craziness has started to subside. Or if based on that remote triage, you sound like, well, I still don't think this is, a true urgent case, or it's borderline right between non-urgent and urgent, I think we need to get a little bit more information. Then you proceed to that remote consultation and kind of decide from there, do I need to do anything else, or can I just simply do this remote consultation and make some recommendations over the phone? So as far as some types of non-urgent and routine cases, a lot of these are going to be pretty self-explanatory. So we already talked about the wellness exams, the vaccinations, kind of the one caveat to the vaccinations are, say in a shelter where they've got large groups of dogs together, where that's an increased risk factor for spreading contagious diseases. Or if you are in an area where there maybe is a disease outbreak of something where you really need to make sure these pets are staying up to date on, a given vaccine, nail clips, weight checks, puppy checks, routine neutering, and any sort of kind of routine reproductive care like artificial inseminations are all types of cases that are considered non-urgent and routine and should therefore probably be delayed. All right, so we will now just quickly review some of the management techniques that we will use for each of our patient types. And so first we will talk about our emergent patients. And so again, like we've already talked about, these patients are going to be classified emergent following a remote triage or potentially following a remote consultation. As these clients present to the hospital, it's recommended those clients do not enter the building. They should remain outside. And you have a staff member that then goes out to meet them, trying to maintain as much distance as possible in order to collect that pet and bring him into the hospital. Once they're in the hospital, the doctors and technicians can do the patient assessment and can then start formulating a treatment plan in terms of what diagnostics and treatments they might recommend to that client. It is important to make sure you are wearing appropriate personal protective equipment such as masks, gloves, because even though we have shown through a lot of the studies done to date that animals don't necessarily, as far as we can tell, contract the disease, they can be carriers of COVID, which means that they could still pass it on to you even if they themselves aren't truly infected. So you should still be careful with these pets because we don't know exactly what the environment is that they are coming from at home. And then once you have kind of major treatment plan, calling the owner over the phone to be able to discuss, maybe get a more thorough history and then discuss that treatment plan and determine how you're going to move from that point forward in terms of the diagnostics and treatments. And then say that pet is hospitalized or is going to have some diagnostics done, making sure you provide regular updates to that client by phone, because if you imagine yourself in a client position where you're in a very unique situation of handing your pet to someone outside and not even being able to enter the hospital building, that level of kind of stress and anxiety for them is going to be much higher than it would be normally. And so if they don't have that kind of regular updates from the veterinary team, it'll make them more apprehensive and uncomfortable with, how sick their pet could be, or they might interpret that as maybe their pet is sicker and you're, having to deal with them and something's wrong. So it's important to make sure you give them regular updates so that way they make sure they kind of feel that connection to what's going on since they can't physically be there. As far as management of the urgent cases go, again, these are going to be cases that are going to go through that remote triage to then determine that they are not emergent. And so we're going to slide over into the remote consultation method. Again, I wrote here ideally video because it would be nice for you to be able to at least see the patient. You're not going to be able to do a full physical exam, but you can actually glean a pretty good amount of information just by watching a video of a pet. Through that remote consultation, you're going to obviously want to get a pretty thorough history, that visual exam that we just talked about, and then following that, discuss your opinions. Again, make sure that you're expressing these are opinions because you're not physically assessing that patient. You're not able to do the diagnostics that you might normally be able to do. So make sure that those clients are aware that these are medical opinions to the best of your ability with the methods that you have in front of you to be able to assess that patient. Give them the differentials that you think could be underlying in their pet, and then what treatment options that you would recommend for a patient like that. And so do those treatment options involve that patient needing to actually come into the hospital, i.e. that patient is turning into an emergent case, or might it be able to do some regular kind of simple management at home? You might be able to prescribe some medications if needed, which we will talk about how to do that in just a second. But then also importantly, having that client provide you with regular updates, just because like how we talked about in that last slide, clients are going to have a much higher level of stress and anxiety with these forms of management because they can't always come into the hospital. So encouraging those clients to stay regularly in contact with you can make them feel like you're doing the best management possible. And that way we know that patient is being very closely monitored as best as we can in this current situation. Now, in terms of being able to prescribe medications to these patients that are not coming to your hospital, the RCVS has changed their guidelines in regards to how we can do this. And they are now allowing veterinarians to prescribe medications to patients without having to have first had a physical examination. And this is really all about limiting that non-essential contact. So these patients don't need to come to the hospital, but maybe they need a prescription medication that's not, a significant medication. Obviously, no chemotherapy drugs, no serious controlled opioid medications or something like that, but something more routine, say metronidazole for a dog with diarrhea. We can now prescribe those medications to a human pharmacy for these owners to go get them, and this pet didn't have to come to the hospital for you to do so. And so a big question is, can these patients effectively be managed remotely by this prescribing method? And so this is where that remote consultation is really important, because that's what's going to help you determine, can I do this remotely with this patient to prescribe these medications and know that I'm not, doing anything that maybe is not in the best interest of the patient. And so when you take this approach, it is very important to ensure that the patient, and that the owner is also aware of this, but that patient is able to be evaluated should their condition deteriorate any further. So if there is continued deterioration as you're kind of doing this prescribing approach, make sure that client knows that we can't just continue to kind of prescribe medications remotely like this if their patient is continuing to deteriorate, because that is now qualifying them as an emergent case and they really need to come into the hospital and be evaluated appropriately. And now when you're prescribing these medications, make sure you very thoroughly review these medications with the owner over the phone. Remember, you're going to be probably sending this prescription to an outside pharmacy, and this owner isn't going to have anything to do with your hospital when they go to get that medication. So if you don't kind of have a discussion with them about how to administer it, the possible side effects, how to store it, they might not know that. And so you need to make sure you discuss that with them over the phone before they even obtain the medication, so that way they're ready and have been educated. And then also making sure you provide these owners with a sufficient quantity to last until an actual physical exam should be done. So really that means giving enough quantity that will get through the end of the COVID outbreak when most of the restrictions are starting to be relaxed. And at that point, if there is any reason that patient should be continued on one of these prescription medications, you now should require that client comes in to get an actual physical exam to make sure that these kind of prescribing recommendations that you made beforehand still hold true when you can actually have the ability to evaluate that patient more appropriately. Now here is a checklist for you to go through when you're trying to assess whether remotely prescribing a medication to a patient is the right thing to do. And so this is going to be for those remote consultation appointments that you're having where you're kind of assessing these patients through a video. And so most important question is, do you have enough information from those remote consultations to be able to safely prescribe a medication to this dog without having a physical exam? Another big question is, based on that physical exam, do I think an immediate intervention is necessary? In which case, sending a prescription to a pharmacy to then have the owner pick it up and then get home and give that dog an oral medication, is that immediate enough for maybe what that dog needs? Additionally, can that treatment be delayed until an actual physical exam is possible? Kind of falling back into the old definitions that the RCVS used to have, which is have that physical exam in place before you start prescribing medications. And so if the answer to this question is no, I can't wait until I can do a physical exam, then that tells you right there that it makes sense to remotely prescribe that drug. There's no suitable alternative, so no over-the-counter medication that's maybe not prescription-based that you might be able to recommend those owners to give. Is there a risk to the animal or the public health by this animal coming in? Is that benefit that the animal would come in not as high as the risk of them possibly either contracting or spreading COVID infection on their way to the hospital? And so if there's more risk than benefit by that patient coming in, that right there tells you it would make more sense to do some remote prescribing. Making sure that the client is fully informed, and this kind of goes back to when we were talking about our remote consultations of having to make sure that these owners understand that these are opinion-based recommendations that we're making because we're not able to fully evaluate these patients. So making sure the clients are fully informed and aware of those facts, and that they have then therefore consented, that they understand that and they are okay with taking this remote prescribing approach. And then lastly, very importantly, make sure you have detailed notes made in the medical records for these patients as to what the decisions were that you made, the reasons that you made them, and also document that you discussed it thoroughly with the client and that the client understands and has consented to this approach. Now, in terms of management of the non-urgent and routine cases, many of these don't necessarily get past the remote triage point, because a lot of these will be owners that are calling, asking to schedule a wellness visit, and simply all you have to do is tell them, I'm sorry, in the current situation of COVID, we are delaying those appointments until an unforeseen date when we know that the restrictions are starting to be lifted. So please, either we will put you on a call list where we will call you when that happens, or reach back out to us when you know that those restrictions are starting to be lifted. However, some of those cases on those remote triage will be kind of skirting that border of non-urgent to urgent, and maybe it makes sense to have a remote consultation if needed with these owners, just to make sure that you don't need to be making any recommendations to these owners in terms of something to do or certain things that they need to be monitoring for that would be the red flags to tell them that their patient is becoming an urgent case. So like I said, most likely you're going to be recommending delaying evaluating these patients until after the outbreak. But again, kind of like we talked about in the earlier slides, making sure these clients provide you with regular updates by phone, because that assures you that you're able to evaluate these patients as best as you can remotely, and also make sure that the client is keeping a close eye on their pet and that we're providing them with the best sort of monitoring and care that we can. All right, so to wrap it up, we just have a couple concluding points. The first is that we have this recognition that COVID has resulted in a lot of challenges for us in the veterinary profession, and these are really unprecedented times without many other situations that we can kind of compare and kind of adapt our current workflow based off of things in the past. And so it's a very fluid and dynamic situation that we all unfortunately are kind of having to change and adjust as we go along and figure it out. most importantly, though, is just making sure you use your best judgment in terms of how to provide the highest quality care to your patients while protecting the health of those patients, your clients, your staff, and the public. And so beyond this presentation, there are several veterinary associations that are helping to provide even more guidelines, more recommendations in terms of how to manage both your practice and how to see and care for your patients. So do check out the BVA, the RCVS, and the BSAVA for more recommendations if you need to. And then, if you guys need anything specifically from us at London Vet Specialists, you're always more than welcome to feel free to give us a call. And with that, thank you so much for listening. Please stay safe and stay well.